Welcome back for another deep dive.
Yes.
Today we're going to be digging into some really cool research on sciatic nerve regeneration. Our listener sent in this article, Regenerating Effects of Platelet-Rich Plasma and Bone Marrow Aspirate on Sciatic Nerve Injuries in Dogs.
Okay.
And it just came out in December 2024.
Wow.
So hot off the press. You know, sciatic nerve injuries are a pretty big deal for dogs, right?
Oh, yeah.
Can cause a lot of pain and problems getting around.
Yeah, unfortunately, they're not that uncommon.
Right.
Trauma.
Yeah.
Sometimes even surgery can lead to sciatic nerve injuries.
So this research could really make a difference for our furry friends. It's all about using things like platelet-rich plasma, PRP, and bone marrow aspirate to help those nerves heal.
Right. We actually already use those in vet med for other things, but using them for nerve regeneration, that's pretty new.
So they took 15 dogs who had sciatic nerves surgically severed and split them into 3 groups. A control group, no extra treatment, a PRP group, and a bone marrow aspirate group.
Interesting. And did they, just see if the dogs could walk again? Or did they do more in-depth testing?
Oh, they did a ton of tests. At 1, 2, and 3 months after surgery. Clinical observations, neurological exams, even biochemical tests, and microscopic examination of the nerves.
That's a seriously thorough study.
So as you might expect, the control group didn't fare too well.
Yeah.
They still had lameness, that knuckling posture.
Right.
And a dropped hock, meaning that leg wasn't working properly.
That's rough. What about the other 2 groups?
Both the PRP and bone marrow groups improved a lot over time.
Good.
But get this, the PRP group did way better than the bone marrow group.
Really?
By the end of the 3 months, no lameness, no knuckling, no dropped hock.
That's amazing. So the PRP is really making a difference in their recovery. What about the neurological exams?
Yeah, those showed the same thing. Both treatments helped, but the PRP group consistently had better postural reactions, showing they had better balance and coordination.
So both their movement and nerve function are getting better with PRP. I wonder what's happening at the cellular level to make that happen.
Well, that's where those microscopic examinations come in.
Okay.
They took a look at the repaired nerves under a microscope.
And?
In the control group, they saw degeneration, messed up nerve fibers, cell death, and a bunch of scar tissue.
Scar tissue, doesn't that usually form when things heal?
It does, but it can actually get in the way of nerve regeneration, like a roadblock.
Oh, I see. So not a good sign for the control group. What about the PRP group?
Their nerves looked much better.
Oh, good.
Tons of Schwann cells, which help guide and support those new nerve fibers, lots of new nerve fibers growing in an organized way.
Okay.
And much less scar tissue.
Wow. So the PRP is really encouraging those nerves to heal.
And what about the bone marrow group?
Yeah, where did they land?
They were somewhere in between. Some Schwann cells and new nerve fibers, but not as many as the PRP group, and more scar tissue.
Interesting. So it sounds like both treatments are helpful, but the PRP seems to be doing a better job at stimulating that nerve regeneration and creating a good environment for healing.
Exactly. It seems like it's giving those nerves the building blocks they need, while also keeping things tidy so they can actually grow back properly.
Makes sense. But why? Why would PRP be so much better than bone marrow aspirate? What's going on at the molecular level to explain this?
So this is where the research gets really interesting. The authors think the key is in what makes up PRP and bone marrow aspirate. They're both full of these things called growth factors.
Growth factors?
Yeah, they're like messengers that tell the body to repair and regenerate tissue.
Oh, so they're boosting the body's natural healing power.
Exactly. And they point out several key growth factors that are in both PRP and bone marrow.
Okay.
But PRP has way more of them compared to bone marrow.
Ah, so maybe that's why the PRP group is healing so much better? Could be. It's like they're getting a bigger dose of that healing message. But it's not just about how much, it's also about the types of growth factors.
Oh, interesting. How so?
Well, PRP is known to be really good at fighting inflammation.
Right. Inflammation is part of healing, but too much can be bad.
Yeah. If it hangs around too long, it can actually slow down tissue repair.
So the PRP is reducing inflammation and creating a better environment for those nerves to heal.
Exactly. It's like clearing the way for those new nerve fibers to grow.
The study also mentioned mesenchymal stem cells, or MSCs. They're in bone marrow aspirate.
Right, MSCs.
Do they play a role in nerve regeneration too?
Possibly. That's something researchers are still looking into. MSCs are pretty cool. They can turn into different types of cells, including nerve cells.
Wow.
So maybe they're helping by becoming new nerve cells or by releasing stuff that supports nerve growth.
So the bone marrow aspirate is like a little repair crew.
Sort of, but we still need to do more research to figure out exactly what those MSCs are doing. Now, there's something else about bone marrow aspirate that the researchers mentioned.
What's that?
It can sometimes have a lot of these enzymes called MMPs.
MMPs. What are those?
They help remodel tissue, but if there are too many, they can actually start breaking down the new nerve tissue.
Oh, that doesn't sound good.
Yeah, it's a delicate balance. You need some MMPs to get rid of scar tissue, but too many can be harmful.
So maybe that's another reason why PRP is doing a better job.
It seems like it has a better mix of things that promote regeneration and reduce inflammation.
So this study was all about the sciatic nerve. Do you think these treatments could work for other types of nerve injuries in dogs?
That's the burning question. The sciatic nerve is the biggest one in the body.
Right.
But there are lots of other nerves that can get injured. We need more research to see if PRP and bone marrow would be helpful for those too.
And what about timing? Does it matter when you start the treatment?
That's another good question. Nerves are slow healers. They only grow back about 1 millimeter a day.
Wow, that's slow.
So the sooner we can help, the better. Early treatment could prevent more damage and lead to better recovery.
I wonder if you could use these treatments before a risky surgery to prevent nerve damage from happening in the first place.
That's a really interesting thought. There's some early research suggesting that PRP might actually protect nerve cells from damage.
That would be amazing, especially for surgeries where nerve damage is a risk.
It's definitely promising, but we need more studies to confirm it and figure out the best way to use PRP in those situations.
This study looked at a clean cut to the nerve. But most nerve injuries aren't that neat and tidy.
Right.
What about crush injuries or gunshot wounds?
That's a good point. A clean cut is a good way to test these treatments in a controlled setting, but it's not the same as what happens in the real world. We need more research to see how PRP and bone marrow work for those more complicated injuries.
And what about nerve injuries closer to the spinal cord? Those are notoriously hard to treat.
Yeah, that's another thing to investigate. We need to understand how the location of the injury affects these treatments.
They only used 15 dogs in this study. Don't you think we need bigger studies to be sure about these findings?
Definitely. Bigger studies would give us more data and maybe reveal some subtle differences between the treatments that we didn't see here.
And they only followed the dogs for 3 months. It would be helpful to know how long the benefits last.
Agreed. Longer studies would tell us more about how durable these treatments are and maybe how often they need to be done.
There's also the issue of nociception, the ability to feel pain.
Right.
None of the dogs got that back in their injured leg, even after 3 months.
Yeah, that's concerning. Sensory nerves usually heal slower than motor nerves, but it's still not good that there was no improvement. We need to figure out why that is.
I wonder if it has something to do with how badly the nerve was injured or how it was repaired.
It's possible. More research is needed to figure that out and find ways to help those sensory nerves heal too.
I noticed they didn't do any nerve conduction studies.
Oh, yeah, those can be really helpful.
They measure how fast electrical signals travel along the nerve.
Right. That would give us more precise information about the nerve damage and how well it was healing.
I think it would be really valuable to include those in future studies.
I agree. It would give us a much more complete picture of what's going on.
This research is so exciting.
Yeah.
It feels like we're just beginning to understand what we can do with PRP and bone marrow aspirate for nerve injuries.
Absolutely. It's a whole new frontier in veterinary neurology, and I can't wait to see what we discover next.
This makes me think about nerve regeneration in humans.
Yeah.
Is there anything we can learn from how human nerves heal that could help us with dogs?
Absolutely. Even though there are differences between species, the basics of how nerves regenerate are pretty much the same in all mammals.
Right.
So what we've learned about treating nerve injuries in people can definitely guide us in vet med.
So we're not starting from scratch.
Yep.
We're building on a whole foundation of knowledge from human medicine.
Exactly. For example, in human medicine, we're using PRP and other biologics more and more to treat all sorts of nerve injuries. Carpal tunnel syndrome, spinal cord injuries, you name it. And the results are looking good.
Oh, wow.
Studies show these treatments can help nerves regenerate faster, reduce pain, and improve function.
It's so cool to see this exchange of knowledge between human and veterinary medicine. It really shows how connected all living things are.
I agree. And it highlights how important it is for doctors, vets, and scientists from different fields to work together.
Yeah.
By sharing what we know, we can develop new and better treatments for both people and animals.
So we've seen how PRP and bone marrow aspirate can help nerves regenerate.
Right.
But could they also be used to prevent nerve damage from happening in the first place?
Now, that's a thought-provoking question. Researchers are actually looking into that right now. There's some evidence that PRP especially might have what we call neuroprotective effects.
What does that mean?
It means it could protect nerve cells from damage, whether it's from trauma, inflammation, or even some diseases.
So imagine if we could give PRP before a risky surgery, like spinal surgery, to protect the nerves.
Right.
Or maybe even use it preventatively for dogs who are prone to nerve damage, like those with diabetes.
Those are great examples. More research is needed to know for sure, but the possibilities are exciting.
It's like instead of waiting for damage to happen, we're trying to stop it before it even starts.
Exactly. A real shift in how we approach nerve care.
And that can make a huge difference for so many dogs and people. Well, that brings us to the end of our deep dive into this amazing research. We hope you found it as fascinating as we did.
From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.